and 15 months, just before COVID hit our economy, we finally had gotten our unemployment rate down to the national number. And I was proud of that fact and hoping that we could get below it, and then COVID hit. 3.4, I think, was the number, if I recall, but you'll correct me. But I know we hit the national number. So now, as to managing the economy through all of this while we're managing COVID, the most important thing that you can do for our economy is to fight COVID, because the truth is most of the economic damage that's done here is done because people don't want to go to public places. Most people look outside and say, I don't want to go to a crowded place. They want to make sure that whatever they're
Good morning, everybody, and welcome to News Now from Fox. Happy Tuesday. It is November 10th. Pilar Arias, your host for the next hour, kicking off the day before Rain Augustine takes over. Then Mike Page in Phoenix, Arizona. We are taking a live look at the Supreme Court of the United States, and that's because a major case is headed there today. And the Obamacare, more formally known as Affordable Care Act, faces another Supreme Court test with bolstered conservative majority. For the third time since its inception a decade ago, the ACA, as it's better known, is headed to the Supreme Court, facing the most conservative panel of judges who have sat on the bench in years. The highest court in the nation will hear oral arguments today in a White House-backed legal challenge to the landmark healthcare law, often referred to as Obamacare. Democrats made the ACA and the lawsuit seeking to rule it unconstitutional the centerpiece of their effort to block the confirmation of Justice Amy Coney Barrett last month. During the confirmation hearings, Democrats warned that Barrett, whom President Trump nominated to replace the late Justice Ruth Bader Ginsburg, would vote to strike down the legislation. So again, we're going to stay on standby for that today. If anything happens, we will have it for you. I'm going to remove this lower third, the graphic as we call it, so you can see people there standing outside of the Supreme Court of the United States. Again, this is live, and we have heard that protesters are in the area, so if we get anything that we can bring you later today, we will do that. But this is one of the most major news stories of the day. We do have a live picture of the Supreme Court, so I wanted to show it to you right here on News Now from Fox. Again, everyone, my name is Pilar Arias. Thank you so much for being here. I want to say hello. I hope you're having a great day so far, an even better week. Believe it or not, we are so close to Thanksgiving and Christmas. Everyone's starting those holiday plans and getting things ready as best they can during the pandemic. So again, we really appreciate you being here. I'm also going to take you out now to the United States Capitol, in our nation's capital, to let you know the latest news from there today. It's a very, very busy day here on News Now from Fox. Yes, there's a hearing that a lot of you are going to want to watch. Mike Page has already created the event for us on the platform that you happen to watch News Now from Fox, where there's a chat feature. So there's going to be a crossfire hurricane hearing today, day 4. The Senate Judiciary Committee holding the 4th hearing in its series of hearings on the crossfire hurricane investigation. The committee will hear testimony today from Andrew McCabe, the former deputy director of the FBI. So like I said, a lot of moving parts here today. We're going to stay on top of it all for you right here on News Now from Fox. But I do want to get to Doug Luzader. He's kind of the Fox News political reporter, not just talking about the election latest, but he's also going to be talking about exactly what is going to be happening in the Supreme Court of the U.S. So again, you are watching News Now from Fox. My name is Pilar Arias. Happy Tuesday. Thanks for being here.
A number of states have deadlines this week to certify election results, but the legal challenges and the calls for recounts are just getting started. Donald Trump and Joe Biden caught in something of an electoral limbo, both claiming victory with the numbers clearly on Biden's side.
This election is not over. Far from it.
The Trump team is pursuing a number of lawsuits alleging voter fraud in several states. Now Attorney General William Barr is telling the Justice Department, while serious allegations should be handled with great care, specious, speculative, fanciful, or far-fetched claims should not be a basis for initiating federal inquiries. Still, a green light to possibly investigate some claims was enough for one Justice Department official to resign his post. A Georgia elections official cautioned that in any election, there will be at least isolated problems.
We are going to find that people did illegally vote. That's going to happen. There are going to be double voters. There are going to be people who did not have the qualifications of a registered voter to vote in this state. That will be found.
But he says it's unlikely to change the outcome.
I won't be president until January 20th.
Joe Biden, meantime, trying to forge ahead. Yesterday, he talked about the coronavirus. Today, he'll address health care and the big case coming before the Supreme Court today, questioning the constitutionality of Obamacare. And those arguments get underway this morning with the court's full complement of 9 justices. In Washington, Doug Luzader, Fox News.
All right, Doug, thanks for the latest there. We're taking a live look at the big board. Dow Jones Industrial trading has not yet started for the day. Matter of fact, we are on standby for the opening bell. I have not looked up yet who is going to be doing that, but if I get any info, or matter of fact, if we're able to watch that live, I'll bring it to you right here on News Now from Fox. Currently 9:04 here on the East Coast. What do you think? Are stocks going to surge for the second day in a row following the news of the COVID-19 vaccine trial by Pfizer? They're saying it's 90% effective. Matter of fact, I have Lauren Blanchard here to kind of break that all down for us. Again, you are watching News Now from Fox. My name is Pilar Arias.
Positive news out of Pfizer's coronavirus vaccine trials, leaving markets happy and scientists and health officials optimistic around the world. The drug company announced Monday its vaccine trials are showing a 90% success rate at preventing COVID-19. This breakthrough comes as the Food and Drug Administration approved a COVID antibody therapy from pharmaceutical company Eli Lilly. That medicine, administered through an IV, is meant for patients not requiring hospitalization, but who still need treatment for their symptoms.
When you get a vaccine, the idea is to make your body produce these antibodies. So here, this medicine aims to give you those right away so that you don't have to wait weeks to build them up yourself.
As the pandemic continues spreading at a record rate, President-elect Joe Biden is trying to unite the country ahead of the vaccine's possible approval.
The single most effective thing we can do to stop the spread of COVID is wear a mask.
Meanwhile, the international community is reacting to Pfizer's news with cautious optimism.
We haven't yet seen the full safety data, and these findings also need to be peer reviewed.
We hope that the first vaccines will be approved quite soon. Above all, I would like to point out once again, nobody will be forced to be vaccinated.
As Pfizer continues working on a vaccine, health officials stress Eli Lilly's antibody treatment is for emergency use only as researchers conduct more tests. In Washington, Lauren Blanchard, Fox News.
All right, everybody, thanks so much to Lauren Blanchard for that latest report there. Matter of fact, we're hearing that President-elect Joe Biden will be speaking on health care today. Very timely, right, with the Affordable Care Act reaching the Supreme Court of the United States. Okay, so we cannot do News Now from Fox without the help of our sister stations across the country. KTVU Fox 2 puts together some great segments all the time that we can bring you here, news that you need to know about, right? So this next segment I have for you is about COVID-19 and money. A lot of people are struggling during the pandemic. Some have lost their jobs. Some have had their hours significantly scaled back. So let's get the latest. Again, this is from KTVU Fox 2.
Well, we have a president-elect, we have a vaccine for COVID-19, and we have Winnie Sun, once again, from Sun Group Wealth Partners. Hey, what's your take, Winnie, right off the bat? I mean, obviously, investors love hearing a vaccine that Pfizer has produced when it comes to the coronavirus.
Yes, absolutely, Mike. This is good news. I think, this is the beginning of giving a lot of people hope this weekend because obviously cases continue to rise, but we want some good news. Pfizer has come out and told us that 90% success on their vaccine. So let's hope that it goes to regulatory levels really soon and Americans can see some light at the end of the tunnel.
It's interesting to see that some of the companies, though, are taking a hit. Companies that have succeeded through the coronavirus, your Pelotons, I don't know how many commercials I've seen for a Peloton. Zoom, what we're doing here, also that company taking a hit. Is that just kind of a one-time thing, or are these companies, you think they'll be struggling down the road if we continue on the path with this Pfizer vaccine?
Well, the Pfizer vaccine obviously was a big deal. And so you see the market up huge. And so there's so many names, unfortunately, that are going to suffer because people are thinking, well, sooner or later, we're going to get back into the workplace. So maybe we won't need Zoom as much. I think more than anything, Mike, a lot of what you're seeing today is some profit taking. We've seen names like Peloton and Zoom and a lot of the other names do very well. Netflix as well, because we've been sheltering in place. However, the main thing we got to remember too is we're not above, or the coronavirus isn't behind us just yet. So we're probably still quite a few months away from that. So there's still going to be some names that you might want to hold long term that might make sense for your portfolio long term.
All right, we have a president-elect, Joe Biden, that was announced on Saturday morning. And I was curious waking up today to see what the markets were going to be because, do they like this Biden being president-elect, or do they, and then we have the vaccine. So it's hard for me to really read. What are you hearing in regards to investors and whether or not they like, Joe Biden becoming the next president of the United States?
Well, I think investors are looking for closure, and I think they feel that they're getting closer to closure. So regardless of who you elected, investors see this as maybe we'll have some clarity of who our next president is going to be. And also there is the pro of having sort of a balance in that, Joe Biden being a Democrat, but then the Senate retaining ownership with the Republicans. And they see that as a good thing because then you might have a better direction next year, and you might have the powers to continue to keep taxes from going too high. For a lot of investors, they see that as one of the concerns of having sort of that blue wave come across. So they're seeing this contrast as a positive, and that's what investors are seeing. That's why even before the news that came out of Pfizer, the market already was poised to open big today.
Yeah. On January 5th, they're going to have that runoff in the state of Georgia for the 2 U.S. Senate seats. So here you are saying that the divided government is good, or investors like to see that. If those seats flip, and all of a sudden you have Democrats in power in the Senate as well, we would see the opposite effect.
Well, I don't know if the opposite effect, but I certainly think that there is a possibility for volatility. Obviously, we're hoping that where you're looking at right now, investors are hoping what they're looking at now is something that they can count on. And we'll see what happens in January. But I think Americans right now are just looking for areas that they can feel hopeful that tomorrow will be better than it is today. And you're certainly seeing a lot of that today. And don't forget, this is a historical thing. Like basically the 4 days after the election, the market was up over 1%. That's historical. We haven't seen that in a very, very long time. I think since the 1980s. And typically, historically, we've seen, if that's the case, the market historically actually just does better a year from now too. So investors are holding to that.
It seems like they like the October jobs report as well, with 638,000 or so payrolls added. Again, something moving in the right direction, and they like to see this.
Yeah, so we're looking for good news, right? So more jobs being added, that's good news, but we're certainly still very cautious and concerned because with that, COVID cases have increased as well too. So we're hoping that, that number one, the vaccine is helpful, and number two, people sort of change that dynamic of having less cases in the future. We probably have to change some of our activities, but overall, this was sort of the news investors were looking for.
Going into year end, what are you telling your clients as we get close to the Thanksgiving holiday and approach December here?
Well, I would say one of the things that you can do proactively right now is have a conversation with your tax professional and definitely your financial advisor, because you want to be mindful that taxes are probably going to go higher next year, if not, in the near future. And therefore, take a look at your portfolio. After this week, many of you might have some profit-taking opportunities, especially if you have long-term capital gains. This is an area to be proactive. If you're in a position to give and make some donations before the end of the year, also a great thing. Do some gifting. So there's definitely things to be proactive about, and I would say focus on the long term. We've seen that time and time and again, that most importantly, you don't want to completely time the market, but you want to make sure that you do have time in the market.
One more political question for you, not to go back to it, but we see President Trump and his campaign team fighting the election in courts, in a number of courtrooms across the country. Does that play a role? Do you think investors really care that that's going on, even though on the other side you have Joe Biden, who assumes he will take the oath of office on January 20th?
So, Mike, that's a great question. And of course, we're talking finances, but from an investor standpoint, I think the investors aren't really taking that concern so much to heart. I think they see the concern that, President Trump is going to fight this, but you can tell the market's up quite a bit. And so investors don't see that as so much of a risk to them as it pertains to their portfolios, their 401ks, their SEP IRAs. So I think this enthusiasm is showing that they feel like better days are ahead, and they feel like they have the clarity that they needed to be able to make those decisions to hold their investments, if not add to their investments long term.
Well, I'm usually not a fan of Mondays, but it's a pretty good Monday the way for the stock market, and then the announcement from Pfizer. So let's hope we just roll the rest of the week in a positive territory. Winnie Sun, Managing Director of Sun Group Wealth Partners, always a pleasure. Thanks, Winnie.
Absolutely. Thank you, Mike. Take care.
We are taking a live look at the Supreme Court of the United States. A little bit of what we call Nat sound coming out there. You can see a makeshift podium set up there in case anybody wants to talk. There could be protesters and the like there in front of the Supreme Court, and that's because this is the third time that the Affordable Care Act, also known as ACA or Obamacare, has landed in the Supreme Courts of the United States. Now, the latest case, California versus Texas, which is based on an earlier lawsuit brought by 21 Republican state attorneys general and endorsed by the Trump administration, argues the ACA was invalidated when Republicans in 2017 eliminated the financial penalty for Americans who don't buy health insurance with the passage of the Tax Cuts and Jobs Act. The court initially upheld the law because of the individual mandate, which required Americans to purchase health insurance or pay a fine under Congress's vast taxing authority. The suit contends that if that part of the ACA is invalid, so is the rest of the law. Legal scholars have laid out a complicated, murky process with no clear answer as to what will happen to the ACA when the conservative-dominated court considers the law today. The Supreme Court may ultimately agree with the Republican states that the individual mandate is unconstitutional, but justices have to address the complex legal concept is invalidated by the court. Does the rest of it still stand? This is a quote. The court isn't split on severability the way it is split on some other issues. Multiple conservative justices on the court have indicated that their approach to severability is not in line with the arguments that the plaintiffs are making in that case. Jonathan Adler, a law professor at the Case Western Reserve University School of Law, told Fox News. Now, Texas is arguing the individual mandate is unconstitutional and therefore so is the entire law. Last year, the Fifth U.S. Circuit Court of Appeals ruled the insurance requirement is unconstitutional, but charged a federal district court in Texas with reassessing how much of the legislation stood without the individual mandate in place. Now, one of Trump's appointees, Justice Brett Kavanaugh, has written opinions focused on the issue of severability, arguing that it's the court's obligation to leave as much of the law intact as possible. Over the summer, Kavanaugh authored an opinion which was joined by conservative Justice Samuel Alito on robocall restrictions, writing that the Supreme Court, quote, presumes that an unconstitutional provision in a law is severable from the remainder of the law or statutes. Other legal experts suggested the court may be reluctant to strike down the health care law in its entirety during the coronavirus pandemic, which has infected more than 10 million Americans, the most in the world, and killed at least 237,700. This is a quote. To strike down an entire broad-based law based on a single provision is probably not where the court would want to go. That's according to Elizabeth Sepper, a law professor at the University of Texas, UT, if you are familiar with Texas. The ultimate outcome of the lawsuit will affect millions of Americans, and the repeal of the decade-old law could leave up to 32 million people without health insurance by 2026. That's according to a Congressional Budget Office report from 2017 about the effects of repealing the ACA. Because of the pandemic, today's argument will be conducted via telephone and streamed live to the public. A decision is not expected until June. So again, we're going to continue to follow all the developments there from the Supreme Court for you right here on News Now from Fox. But again, everyone, my name is Pilar Arias. Thanks so much for being here with us. Some of you are going to see a very quick commercial break. For the rest of you, we're continuing on, and we're going to stick with our sister station, KTVU Fox 2. They actually spoke with a COVID-19 researcher. Again, you're watching News Now from Fox. My name is Pilar Arias.
Well, we have a president-elect, we have a vaccine for COVID-19, and we have Winnie
Hello, everyone, and welcome. I'm Heather Holmes with KTVU Fox 2 News here in the San Francisco Bay Area. And joining me once again is Dr. Rashid Thotani. He is medical officer at IEM and someone that we've been talking to now for several months regarding the coronavirus. Thank you so much, Doctor, for being here once again.
Thank you for having me to talk about this very important subject that is affecting the country in a very adverse way right now.
Yeah, and Doctor, right now, a lot of people's attention is on the presidential race, but the coronavirus is something that we can't forget about. I mean, the numbers continue to trend in really the wrong direction.
You're absolutely right. And like 2 weeks ago when we were talking, unfortunately, I had also predicted that we would have about 100,000 cases by election day. And guess what? We have exceeded the number of cases, 100,000 cases yesterday. 103,087 cases were recorded yesterday, which is a 25% increase over the past week. Unfortunately, the testing has not really gone up. So these are real cases. Testing has only gone up 4.25%. So we're definitely not moving in the right direction. This is the first time across the world that a country has had 100,000 new cases with 52,000 new hospitalizations yesterday and over 1,000 deaths yesterday, which is again a 24% increase from 4 weeks ago.
And what do you make of the increases that we're seeing? What do you attribute those to?
Well, we always said that, you know, the numbers are going to go up. We expected the numbers to go up in the fall, and they have gone up. Right now, you know, 16 states are hit really bad with a record number of hospitalizations. We have El Paso that had over 1,041 hospitalizations yesterday, and they had to stand up 4 mobile morgues over there, which is really, you know, heartbreaking to even think about. The reason that we've had these cases and the number of cases going up, we expected that you know, during the second wave, when everybody's indoors, and obviously a lot of people had, you know, not were taking, you know, they let down their guard because, you know, we honestly have COVID fatigue. We are tired of this disease, but, you know, the numbers, because of, you know, the infections now moving to the rural areas, more infections in younger people because some of the schools open, some of the early openings, and I am for opening the economy, but in a very, very, very tight and a strict way. These numbers are going to go up. We've not really reached the peak of this second wave, which is this third surge of coronavirus in our nation, and it is still going to go up, and it is going to be just devastating by Christmas because, you know, a lot of people are not going to have their family members with them for dinner during the holidays.
Yeah, that is such a sobering thought for so many people. Doctor, though, when you think about the increase, what do you think might be the correct response right now to what we're seeing?
Well, the correct response is the same that we had. You know, we have 2 different things that we have to think about. We have to think about the medicinal response and the non-medicinal response. So we are on track of developing vaccines. We have developed some therapeutics. Some of them are working, some of them are not working as well as we expected. But we are moving very, very close to getting a vaccine out. Most of the states have been told to receive the first vaccine batches by November 15th. I don't know if that's going to happen because we still don't have the FDA approval, emergency authorization approval, or any of the vaccines, although there are 4 candidates, at least 3 candidates that are the front runners that expect to get their vaccine out soon. So right now, what do we need? We need to make sure that we are wearing the mask, we are observing social distancing, and we are doing hand hygiene. We have nothing, unfortunately, at this particular point. Yes, if you're hospitalized, and I don't want you to be hospitalized, you know, there are things that are being done in the hospitals because we've learned how to deal with this disease. So our mortality, fortunately, has declined a little bit compared to the number of cases. But for the general population, there's no drug that is available. There's no vaccine that is out as yet. So you got to make sure that you are using the common sense measures to protect yourselves, your family, your neighborhood, in the entire country, we all have to unite on this thing. And if we do that, I can assure you our number of cases can be controlled. They will still go up, but we can control them. Without it, they will just skyrocket.
Yeah, we have to really all work together on this. Doctor, you mentioned a vaccine. Obviously, work is continuing, hoping to make some progress. But what do you make of how this vaccine might eventually be distributed? And do you think there is an appropriate plan in place?
Well, in terms of the vaccine, one of the things that is that everybody should understand and appreciate that the threshold of the effectiveness of the vaccine is 50%. So no vaccine, so far there are no vaccine. There's just a couple vaccines, specifically one vaccine that is 95, 97% efficacious, measles vaccine, but no vaccine is 100% efficacious. So even if you get the vaccine, it doesn't mean that you're not going to get the disease or you're completely protected against the disease. Only 50% of the people will be protected against the disease. Our intention is that, 70%, at some point, 70% of the population of the United States, that's about 229 million people that get the vaccine. And then, obviously there are X number of people, maybe 10% of the population that already has contracted the disease and has recovered, and somehow build the herd immunity to a point that 70% of the people are protected from the disease. Now, what does that mean? If 70% of the people are protected from the disease, what it means is that if I have either had the vaccine and I'm in that lucky group that is the 50% where the vaccine is working in my body and I'm developing the antibodies, or I have developed the disease, or now I'm immune to the disease. If I come in contact with another individual who has the disease, I won't get the disease and I won't pass the disease to the next person. So you break that chain, and that is what we want to do, but it is going to take a long time to do it. Now, the other big problem that we have is I just mentioned 229 million people that have to be vaccinated across the nation.
Right.
We know that there are, there are two vaccines that are the front runners that require refrigeration to a point that, sometimes it's not possible, -70, -30, whatever it is. It is, that's serious. You cannot break the cold chain. If you break the cold chain, what happens is that the effectiveness of the vaccine disappears. So it has to be transported under very strict conditions. Then it has to be put in some place without too much interference in moving it from the truck or the plane or wherever. So it's going to be flown in. Then a truck which has the right refrigeration picks it up and takes it to a point which has the right refrigeration where it is, secured. And then you have to monitor the temperature constantly to make sure that the efficacy or the effectiveness of the vaccine doesn't go down. So this is not a trivial task. Now, some of the states are equipped with some of this stuff. Some of the states are not equipped with some of this stuff. We do not have a federal response for this, for vaccine distribution and administration. We need that desperately, because each state, going their own way might not be, the most effective thing to do at this point.
And so what might a federal response, a federal plan look like in your opinion?
A federal plan would make sure that there is equitable distribution of vaccine to all the different states, number one. Number two, it would look like the provisions or the resources are provided to states where they do not have the resources for storing the vaccine. And then it has to be decided through a federal response how and who are the people that are going to be the priority people who are going to get the vaccine. We've talked about the priority already. We've talked about first line defenders, medical professionals, nursing homes, and that discussion has gone on. But a recent study has come out, and it makes some sense. Who are the people who are getting most of this disease? Young folks are getting the disease. They're spreading it to the older folks. And now what's happening is that, the young folks do not have to go to the hospital, usually do not get a worse disease. So like flu, perhaps we have to come up with a strategy that we take the young group first and then their parents. At the same time, we are taking care of the healthcare workers and the first line defenders and perhaps nursing homes. But we have to come up with a plan. And we have to come up with a strategy how we are going to do all of this thing. as a nation, not individual states, because then, one state might get something, the other state might not, and one state might be operating under different standard operating procedures, other might be operating under different. And what we need is to make sure that our entire nation is fighting against this virus as one unit.
Yeah, that's something that we'll be waiting to hear from. Obviously, right now, though, all the attention is on the outcome of the presidential election. But hopefully in the coming weeks, if not sooner, we'll hear more about how the federal government plans to distribute a vaccine, all of us keeping our fingers crossed that that's sooner rather than later. Dr. Chotani, we are just about out of time. I know that you like to leave the audience with a final thought. What might that be today?
Well, one of the things that has come to light, and a lot of people are talking about it, is that we are going to have another problem with the supply of N95 masks. Hospitals are starting to ration those masks. So, with all the numbers going up, everything going up, what I want everybody to do is to once more, and I keep repeating this thing, wear a mask, make sure you're keeping the social distance, and make sure that you're hand washing. I know it's difficult, especially during this time. And believe me, it is as difficult on you as it is on me and my family. And what we have to do is to make sure that, we are protecting ourselves and everybody else around us. That is the only weapon that we have against COVID at this particular point. And let's use that to make sure that, we can decrease the number of deaths and the number of cases in our nation. Thank you.
Yeah. Such simple measures, but they can make a big difference. Dr. Chotani, really appreciate it. Thank you so much.
All right, everyone, the opening bell is going on now. New York Stock Exchange openings bell is by Noah Holdings today on this Tuesday there. You see the excitement, of course, the day after such a good day on the stock market, not just for the New York Stock Exchange, Dow Jones Industrial, but other stock trades as well. So we're going to keep a very close eye on it. Here's currently, because they have the futures. This is how the big board is looking as of right now, up about 100 points to start the day. We're getting a little bit of activity outside of the Supreme Court of the United States. Remember the Affordable Care Act, Obamacare, ACA, however you would like to refer to it, for its third time in its history. It has made it all the way to the Supreme Court. So we are going to continue to stay on top of all developments there. I also see a podium where we might be getting some senators speaking at. I'm keeping a very close eye on it. If there's any activity, I'll bring it to you right here on News Now from Fox. But meanwhile, I'm going to take you out to an update today. Regina Gonzalez did an interview talking about what's at stake with the Affordable Care Act. What could people possibly lose? What could happen as a result of this case in the Supreme Court? Again, you're watching News Now from Fox. My name is Pilar Arias. And matter of fact, some of you are going to see another quick commercial break.
Hello, everyone. You're watching News Now from Fox. I'm Regina Gonzalez, joined today by Rosemary Enobakari, who is the campaign director for Healthcarevoter. Rosemary, how are you? Thank you for joining us.
I'm well. Thank you for having me.
Thank you. Well, we're here to talk about what is at stake if the Affordable Care Act is repealed by the Supreme Court. So before we get into that information, can you tell us what is healthcarevoter.org and what is your mission?
Totally. Healthcarevoter is an organization working to make sure that people have access to quality, affordable healthcare. And we're really also working to lower the cost of prescription drugs. Healthcare is something that we all need in this country, Republican, Democrat, Independent, everybody. And so we need to be working together in order to make sure that folks have access to quality care. And the Affordable Care Act provides us that care.
Now, we are in the middle of a global pandemic. How has the COVID-19 pandemic affected our healthcare system?
Look, COVID has really exposed some of the cracks in our healthcare system. We all know that the Affordable Care Act needs to be updated and made stronger. However, the Affordable Care Act is definitely a lifeline for millions of people across the country. Not only are we in this public health crisis, but we're also in an economic crisis. And so people who have lost their jobs are relying on the Affordable Care Act to be able to provide care for themselves and their families. But also it's important to know that the Affordable Care Act provides protections for millions of Americans with pre-existing conditions. And not only that, young people who graduated from college and who may not have received a job are also able to stay on their parents' insurance through the age of 26. So it's all something that's really important and really critical, especially in this moment when we're in the midst of a global pandemic.
Now, can you explain to the viewers, why is the Supreme Court reviewing the Affordable Care Act beginning tomorrow?
So Republicans in Congress have worked tirelessly, along with Donald Trump, to take away the Affordable Care Act, to repeal the Affordable Care Act. We've heard it time and time again, but unfortunately, they want to repeal it and not replace it. They tried in Congress to repeal the Affordable Care Act, and the American people said no. And they showed up in 2016 overwhelmingly and demanded that we protect people's right to health care and the Affordable Care Act. So since they couldn't take it away through Congress, they decided to take it to the courts. And as you know, Donald Trump has packed the courts across the country and the Supreme Court with conservative judges who will work until they cannot to take away health care for millions of people. And it's important to also remember that there's no replacement. So folks will just be left without anything, without protections, without the care that they need, and in the midst of a global pandemic.
Now, what will the Supreme Court case California versus Texas focus on?
So we'll focus on the entire law and if it will remain in place. Tomorrow, November 10th, we will start. They will start the opening arguments for that case. We won't get a ruling until later next year, but it's important that people make their voices heard right now in order to ensure that folks know why this important law needs to continue to be protected.
Now, what is at risk for Americans if the Affordable Care Act is repealed?
Young people who have been relying on their parents to stay on their insurance to 26 will not have access to that. Medicaid expansion will no longer be the case. People with pre-existing conditions will no longer be able to have the protections that cover them, that allow them to have insurance. Insurance companies will once again be able to discriminate and not cover people or charge them at a higher rate. Women, being a woman before the ACA was considered to be a pre-existing condition. All of these things are at stake, and it's something that we need to make sure that we're making our voices heard on, because we need to continue to keep this important law intact. We need to save our health care.
Now, where can viewers go to show their support for the Affordable Care Act?
Totally. Look, people should go to healthcarevoter.org and tell their story. We have a mechanism where people can share their story. Follow us on Facebook, talk to us, communicate with us. We are Healthcare Voters. Our tag is Healthcare Voters on Facebook and Instagram. And again, our website is healthcarevoters.org.
Is there anything else you'd like to add before we wrap up?
Look, this now is the time that we need to continue to make our voices heard. We're in a very critical moment. Again, I've said this before. We're in the midst of a global pandemic and an economic crisis, and the Affordable Care Act is literally a lifeline for millions of people across this country. And so we need to do everything that we can in order to protect this important law that provides access to quality care and really continue to push for lowering the cost of prescription drugs.
Well, we appreciate your information and sharing this with our viewers. Thank you so much, Rosemary.
Thank you.
Illegal. I don't think about it. I deposit every letter zero. Thinking of my partner. Put the candy penning on a Rico. Digging in my pocket. And a
All right, everyone. So they're having a little dancing demonstration there at the steps of the Supreme Court of the United States. I was hoping somebody would be speaking at the makeshift podium there, but there were some very quick remarks before this dancing got underway. So we're going to continue to keep a very close eye on any developments for you and bring you the latest right here on News Now from Fox. My name is Pilar Arias. I'm here with you for about another 20 minutes or so. Continuing on with our coverage, thanks to our sister stations across the country, I'm going to head on over now to, I believe it's Fox 6 in Milwaukee. They have a kind of a sad story. It's about a minute and a half long, talking about a COVID-19 Down syndrome related death. So very sad news here for this family, opening up about exactly what happened and how COVID-19 and the pandemic have impacted their lives. Again, you're watching News Now from Fox, and my name is Pilar Arias.
She brought so much joy to our family.
Ann Galoon is remembered by family as a trailblazer.
Ann was the centerpiece of our lives.
Born with Down syndrome, she pushed past adversity throughout her life.
She really overcame barriers to live a full, beautiful, rich life.
A new challenge came when the pandemic hit. Family says a 71-year-old was living in a group home when she fell ill over the summer. Her niece, Maggie Haddock, remembers the first sign something was wrong.
She was very confused. She didn't know who I was.
Galoon was hospitalized and tested positive for COVID-19. She died in July, away from her close-knit family.
It was scary for her.
She was a gift to us because she opened our eyes to someone who was different and had challenges.
She grew up with Milwaukee Mayor Tom Barrett, the two longtime friends.
She was so open and friendly that it was impossible not to include her.
We just miss her so much.
Months later, her family continues to share her story and a message.
Listen to medical experts, listen to scientists, wear a mask.
Hoping the surge in coronavirus cases slows down soon.
As a community, as a state, as a world, we really need to do our part to protect those that are vulnerable. People like Anne.
In Milwaukee County, Aaron Mabin, Fox 6 News.
All right, everyone, there's now someone speaking at that podium at the steps of the Supreme Court of the United States, so let's listen in live.
But had a cesarean. That means someone who has some sort of heart condition, high blood pressure. All of these things are pre-existing conditions. We need to make sure that health care is affordable to all people because health is a right, not a privilege. Yes, yes? Yes, yes. All right. So today we're going to share stories of folks who are directly impacted by this issue. These stories are heartfelt because they impact real people. When the Supreme Court makes a decision, it is going to impact millions of lives across this country. We have to make sure that they understand that. We have to put people first. We have to put people over profits. Yes, yes? Yes, yes. People over profit. People over profit. People over profit. People over profit. That's right. Healthcare is a right. Not a privilege. Make sure that healthcare is affordable and available to all people in America. And the reason I say all people in America is because if someone in America is sick, they can make someone else sick. It does not matter where you're from. It does not matter the color of your skin, the texture of your hair, the way you speak, your level of education. We all need to have access to quality, affordable healthcare as a baseline. Yes, yes? All right, so the stories that you are about to hear are going to speak to that fact. And I realized that I skipped an important piece. My name is LaDon Love. And I'm the Executive Director of Spaces in Action. Spaces in Action is an affiliate of the Center for Popular Democracy. And we are a proud member of Shutdown DC. With that said, we're going to have folks come up that are from national organizations and local organizations. Why is that important? Because not one organization can do this work alone. We have to work collectively. There's enough issues for us to come together, share those stories, and push forward solutions together. Yes, yes? Yes. All right. So I'm going to ask Rebecca Wood, who's a healthcare advocate and a member of CPD, to come up and share her story. Let's give her a big hand. And in between each person, I'm going to be wiping off the mic that they're holding. So that may give us a little bit of a delay, but safety first. Yes, yes? Yes. All right.
I'll stay here? Okay. Huh? Oh. No, thank you. Good morning! Oh, no, you guys can do better than that. I said, good morning! Good morning! That's better. Okay, so Charlie and I have been at this for 4 long years now, and most of you probably know our story. Due to severe preeclampsia, Charlie was delivered via emergency C-section at 26 weeks gestation. She weighed 1 pound, 12 ounces, and was the size of my hand. Her birth is a pre-existing condition, and without the ACA, she risks becoming uninsurable. Not only that, her 3-month NICU stay would have exceeded a lifetime cap before she ever came home the first time. Charlie started this fight 4 years ago when she was 4. She's 8 now, and my fears have evolved as she's grown. When she was 4, she had a feeding tube and relied on insurance to eat. What did you say? That was actually when I was 3. No. When I first started fighting for the ACA, I was worried if we lost insurance, how was I going to feed my child? I had no idea how that was going to work for us. Fortunately, we won in 2017, and we managed to hang on in 2018 and in 2019. And here we are in 2020 fighting again. And this time, Charlie no longer has a feeding tube. She got better, and the ACA made that possible. But now I worry that she will not have access to health care. And what kind of future does anybody have without access to health care? So we are out here fighting with the rest of you. And just like in 2016, 2017, or in 2018, 2019, all of those protests that we came out for, 2020, we're doing the same old chant. So those of you who know it, do it with me. When healthcare's under attack, what do we do? Stand up, fight back. Louder! When healthcare's under attack, what do we do? Stand up, fight back. One more time so they can hear you in there. When healthcare's under attack, what do we do? Stand up, fight back. Let's do this. And hopefully this is the last time we have to do this. Let's go. Let's fight. Let's win.
Hi, good morning. My name is Meredith Basie, and I'm with Universities Allied for Essential Medicines, which is a global student group all across the world fighting for access to life-saving medicines. One of the things I wanted to make sure we included when we're talking about fighting for access to healthcare is including immigrants, who, including myself, who are not necessarily citizens of the United States of America yet. We also need to make sure, as LaDon said, that when we protect health, we are protecting health for everyone. We are not safe until all of us are safe. In case you were wondering, as many as 68,000 people are expected to die as a result of if the ACA were to be repealed. We cannot allow that. We've already seen 234,000 people die because of COVID. We cannot allow this increase to happen. And people have already lost their health insurance this year because of the pandemic. So without further ado, I just want to introduce an amazing young person who's joining us from the Sunrise Movement. If she could join us, Maura O'Reilly. And there will be Spanish translation as well, right? Please.
Hi, everybody. Oh, is this on? Hello.
Oh, that was.
What do I think? Oh, no, on the side. Got it. Hello. Hi. Hi, everybody. My name is Maura, and this is Aura, who's going to be providing translations for me. A few years ago, I had a seizure. It was early on a Friday morning. I was in bed, and my roommate saw me seizing and called an ambulance. I barely remember anything from the subsequent few days, but what I do remember is getting hit with a $945 bill for a 5-minute ambulance ride and a $26,400 bill for a one-night hospital stay.
Hace unos años atrás, a los 19, Maura tuvo una incautación. Era un viernes por la mañana y su amiga lo vio teniendo un ataque. Tuve que llamar a una ambulancia. En verdad no se acuerda mucho de esos días, pero lo que sí se acuerda es que le dieron una cuenta de $945 por estar en una ambulancia por 5 minutos y $26,400 por pasar una noche en el hospital.
Something I've learned from that $26,400 one-night hospital stay is that I have epilepsy, a seizure disorder that is on almost every single list of pre-existing conditions. Something I also learned from that $26,400 one-night hospital stay is that maneuvering through our current healthcare system is an unintelligible nightmare, even for those with access to resources that are supposed to guide you through it.
Algo que aprendí de esa noche de $26,400 en el hospital es que tiene epilepsia, un desorden que aparece en casi todas de las listas de condiciones preexistentes. Algo que también aprendió es que nuestro sistema de salud es una pesadilla burocrática para todos.
I'm here today as a recent college graduate trying to find a job in a pandemic-wrought world, in a tanking economy, with a pre-existing condition that requires daily medication and appointments with a neurologist. Trump stacked this court to chip away at any semblance of reasonable health care in this country in order to benefit the private insurance companies, not we the people.
Estoy aquí hoy como reciente graduada de una universidad, tratando de conseguir un trabajo durante una pandemia con una economía rota y una condición preexistente que requiere medicación diaria y cita a la neuróloga. Trump apiló la Corte Suprema para tratar de convertir nuestra salud pública en un asunto privado solo para el beneficio de sus amigos.
I am terrified about living in a country that does not guarantee me health insurance, and even more terrified about living in a country that disrupts the current systems with no viable replacements in mind. If the ACA is struck down because of the way that our healthcare system is set up, myself and millions of other young people, a lot of whom I see here today, will lose access to care most of us need to survive this country. The minute the ACA is struck down, I am floundering.
Estoy aterrorizada de vivir en una nación que no me garantía el acceso a seguros públicos. Y estoy hasta más aterrorizada de vivir en una nación que destruye lo que tenemos ahora sin ninguna opción viable para reemplazarla. El minuto que la ACA se destruye, nos quedamos sin nada.
We have to save the ACA and then keep working to make sure that every single person in this country is cared for and does not die because of the cost of their care or the stacks of forms they have to fill out to get it. Healthcare is a human right, and we will keep fighting for it because our lives depend on it.
Tenemos que salvar la ley del cuidado de salud. Tenemos que seguir trabajando para que cada persona en esta nación tenga cuidado y acceso a la seguridad de salud. El seguro público de salud es un derecho humano y no debe ser un lujo para aquellos que puedan
Again, everybody, the Affordable Care Act, ACA, Obamacare, has made it to the Supreme Court for its third time in its decades-long history. You're watching News Now from Fox. Kind of funny there. The system just pulled me up in a weird double box. I have no idea how or why that happened, but I just want to let you know that I'm here with you. I'm going to take some of you to a commercial break right now. For the rest of you, we've got a little bit until Rain Augustine is coming up here to be your host for just a little bit. And we're staying on top of everything for you right here on News Now from Fox, all the breaking news across the country. They might be done with their Spanish. I'm going to pull up the audio here again. If they are not, we've definitely got some other news of the day that we can bring you right here on News Now from Fox.
It is your bravery that is creating space for the work that we're doing and for what we're calling for. And I want to honor that. Yes, let's give them a hand again. Next, we're going to hear from Tang Hong, who is a community organizer with Nakasak. Did I say the name incorrectly? I'm a work in progress. I'm a work in progress. All right, let me have you come up. Tell me, correct me, say your name.
Ha Tang.
Hong Tang.
Yeah.
I said it right now?
Ha.
Ha. Ha Tang. Okay, hey. This is a learning process for all of us, right? Yes, Jess? Yes. Let's give her a hand. As she steps up, I'm just going to wipe off the mic from her. All right, then. She meant to do that.
Thank you. Healthcare is a fundamental human right. It is extremely
to even consider repealing the ACA during a pandemic. My name is Ha Tang, and I'm with Naugatuck, Virginia. We work with Asian Americans to achieve justice. A few weeks ago, I had to rush my uncle to the ER because his legs, face, and stomach were swollen. He had trouble walking and breathing. A few x-rays later, we learned that excess fluid had built up in his body because his heart was failing. He is one of the people in my family on ACA. He is now slowly recovering. His workplace used to provide health insurance, but they eventually stopped to cut costs. He was then without health care insurance until the ACA came into effect in 2010. I would like to share with you a phrase in Vietnamese, "Sức khỏe là vàng," which means healthcare is gold. This emphasizes on the value of healthcare in our lives. Money may get you a lot of things, but you cannot buy good health. I am here today because the ACA gives me a peace of mind that my family can receive healthcare. Healthcare is for everyone. Healthcare is a fundamental human right. We're gonna try a call and response. I'm gonna say healthcare for who, and you're gonna say healthcare for all. So healthcare for who? Healthcare for all. Healthcare for who? Healthcare for all. For who? All. Woo! Thank you, everyone.
Thank you again to thank you again to Ha Tang. Can you give her a round of applause? Thank you. So we agree. Health is wealth. Health is wealth. Now, right now we have the honor and privilege of having a local DC musician who is Sterling and his Too Much Talent Band who are going to play for us next. So if you want to come through, come join the stage. Thank you. So Sterling and his Too Much Talent Band. Thank you.
Again, everybody, you're watching News Now from Fox. They're essentially starting to jam out there at the steps of the Supreme Court of the United States. They are in favor of keeping the Affordable Care Act. They want it to maintain the law of the land. So we're going to continue to follow all the developments for you here on News Now from Fox. My name is Pilar Arias. I'm going to be hopping off here in just a few minutes. I do want to show you what we're kind of on standby, though. We do have this live picture. We call it a Congressional Stakeout Cam. So senators, congressmen, and women are more than welcome to come to this makeshift podium and make any sort of remarks that they want to. When and if that happens, we'll bring them to you right here on News Now from Fox. We also have a live picture of the Dow Jones Industrial Big Board, currently up about 100 points, nothing but green today, but the trading did just start not long ago. So we'll keep a very close eye on the stock market after a successful day. At least most would consider it successful yesterday after the news that the Pfizer COVID-19 vaccine trial was 90% effective. A little bit of glimmer of hope in the health world, especially during this pandemic that has impacted millions of people's lives across the globe. So we'll keep a very close eye on that for you here on News Now from Fox. I'm actually going to take you out to the state of California, where our sister station Fox 11 Los Angeles did a segment about Californians, how many are covered and how the ACA is impacting their lives. Again, you're watching News Now from Fox. My name is Pilar Arias. Thanks for being here.
For all the great work we've done, if you look around California, there are still about 3.5 million uninsured. Now, the biggest number of them are undocumented individuals not eligible for financial support, generally. Our state, though, has said every person in California should have coverage. Every American should have coverage. We're down that path. But what we're doing right now in open enrollment is there's about 1.2 million Californians eligible for either Medi-Cal or Covered California. We're getting the word out.
Speaking of getting the word out, that was Peter Lee, the head of Covered California, during Governor Newsom's briefing today. He joins us now live via Skype to get the word out. I like your headset. It looks like you're about to cover a football game, so hopefully you can do that in the break for us. Most important thing we need to know right now about open enrollment and getting health insurance in this state.
So let me put it, it's really clear and really easy. First, if you're uninsured, go to coverageca.com, and you might actually be eligible to sign up and have coverage start in December for a month and then re-up for the entire 2021 year. But open enrollment's the one time in the year when if you're uninsured, no one can turn you away. So, you know, a lot of the people that are uninsured don't think they qualify for financial help. A lot do. And if you aren't sure, check again. In 2 minutes, you can find out how much help you'll be eligible for. 90% of the people with us get a lot of financial help to make healthcare affordable.
Literally in 2 minutes. And I have the damnedest time getting uninsured people to sit down at the computer. Young, healthy people, just, I don't understand the thinking. California Care, Covered California does such a great job. The website is easy to use. It's affordable literally to everyone. And if you don't get insured, you're not in control of your health care.
Well, there's two things. Number one, now, California, and this comes up talking about the Supreme Court case, California passed last year a law where if you don't get insured and you can afford it, you'll pay a penalty with the state franchise tax board. But that pales in comparison to showing up in a hospital. Like right now, you go to the hospital, you get COVID, most people are walking out of the hospital. But if you had to pay that bill, it would be $60,000. That's what people think. They think they will roll the dice. They shouldn't be rolling the dice. Get the insurance, coverageca.com. You really can find out in moments.
Peter, let's talk about this big Supreme Court case that is going to happen tomorrow. It's literally called Texas versus California. California is fighting to keep the Affordable Care Act, the Obamacare. Let's put some stats up onto the screen of just how this would impact California if Obamacare was overturned. Right now, 1.2 million people in California are uninsured. 6.1 million people have pre-existing conditions. They could lose those protections if Obamacare is overturned. And right now, our state is getting $27 billion in federal funding for health care costs. What is the state's argument tomorrow, Peter?
Well, first, I actually have a lot of faith in all 9 justices, because the argument that is before the court is that the mandate is unconstitutional. But the next argument is because it's unconstitutional, throw out everything else. And that just boggles the mind legally or by any logic. Look, the Affordable Care Act says we're going to provide financial help to people, unconnected to the mandate. The Affordable Care Act says seniors are going to get help with their Medicare prescription drugs, unrelated to the mandate. Affordable Care Act says let's provide money for the CDC to do preventive work like fight COVID, unrelated to the mandate. The idea the Supreme Court would throw all this out is crazy. I mean, it really is. I mean, it makes no legal sense, no logical sense. And I'm really confident that the Supreme Court, every 9 members are going to look at the law and say, we might not like the mandate. It might not hold water, but we can't throw out the rest. I agree. I think one of the things that I'm sorry, go ahead.
I just agree. I think you're absolutely correct. It doesn't make any sense to me at all they would roll that back. I don't see how.
The other thing, I live in the present, though, also, is so for Californians, even if you think the sky will fall, it won't fall in 2021. Sign up for coverage. Even the Trump administration is saying, if you throw out the law, don't do it overnight. Yeah. So people should still be getting that coverage, because Supreme Court, long time away before they make a decision. COVID could happen tomorrow. Cancer could happen tomorrow. You don't want to go uninsured.
And of course, you can sign up for that on the Covered California website. Peter Lee, thanks for being with us. We'll be right back.
I want to note that for all the great work we've done, if you look around California, there are still about 3.5 million uninsured. Now, the biggest number of them are undocumented individuals not eligible for financial support, generally. Our state, though, has said every person in California should have coverage. Every American should have coverage. We're down that path. But what we're doing right now in open enrollment is there's about 1.2 million Californians eligible for either Medi-Cal or Covered California. We're getting the word out.
Speaking of getting the word out, that was Peter Lee, the head of Covered California, during Governor Newsom's briefing today. He joins us now live via Skype to get the word out. I like your headset. It looks like you're about to cover a football game, so hopefully you can do that in the break for us. Most important thing we need to know right now about open enrollment and getting health insurance in this state.
Yeah. So let me put it, it's really clear and really easy. First, if you're uninsured, go to coverageca.com, and you might actually be eligible to sign up and have coverage start in December for a month and then re-up for the entire 2021 year. But open enrollment's the one time in the year when if you're uninsured, no one can turn you away. So, you know, a lot of the people that are uninsured don't think they qualify for financial help. A lot do. And if you aren't sure, check again. In 2 minutes, you can find out how much help you'll be eligible for. 90% of the people with us get a lot of financial help to make healthcare affordable.
Literally in 2 minutes. And I have the damnedest time getting uninsured people to sit down at the computer, young, healthy people.
Good morning, everyone. You are watching News Now from Fox, and my name is Rain Augustine. Now, if you aren't familiar with us, we are a national platform. We are streaming breaking news, live events, and stories that are taking place around the country. Now, today, of course, the big news is the challenge to the Affordable Care Act. Let's take a look at a live picture from the steps of the Supreme Court where protesters are letting their voice be heard. Again, my name is Rain Augustine, and you're watching News Now from Fox.
Justice Barrett now has a secure lifetime job with access to some of the best health benefits in the country. Few other Americans are so lucky. While I certainly believe that every Supreme Court justice and their families should have access to quality health care, I do not believe that this right should be guaranteed only to the wealthy and powerful. Neither does Joe Biden, whom Americans just elected with a record number of votes, with many of those votes being cast before Justice Barrett was confirmed. Instead, I believe that everyone deserves the right to access health care, even if they were born with pre-existing conditions. It is stunning that after making so much progress towards achieving this goal, we are now on the cusp of limiting access to health care rather than taking steps towards expanding Medicaid and other programs that will ensure that everyone has access to the health care they need. I believe that the voice of the American people who just voted in overwhelming numbers to support the ideals of compassion and that every life has value should be heard. I believe that the Supreme Court should not be making policy. After 4 years, no viable alternative to the ACA has been proposed. The ACA must stand. Claire deserves better. We all do. Maybe like two. Can you like get behind? What are we doing? I can. Just stand. Stand behind the stage? Yeah, just stand if you can get behind, otherwise. Oh, it's kind of tight, huh? Sorry. I can do it.
You're looking at a live picture of the Supreme Court where today oral arguments challenging the Affordable Care Act will be heard. Now, about 6 weeks ago, 5 Supreme Court justices who had twice preserved the Obama-era health care law remained on the bench and seemed unlikely to vote to dismantle it. But since Justice Ruth Bader Ginsburg's death, her replacement by Amy Coney Barrett is leaving uncertainty in the balance as the court prepares to hear arguments today. Actually, those arguments are underway right now. We are working to bring those to you now. This is the third major legal challenge to the law's 10-year existence. About 8 years ago, the court ruled to leave components of the Affordable Care Act in place, but the Supreme Court is now controlled by a 6-3 conservative majority after President Donald Trump appointed the Justice Amy Coney Barrett. Barrett, along with Justices Neil Gorsuch and Brett Kavanaugh, are of the 3 appointees from President Donald Trump who will be weighing in today. It's their first time hearing a major case over the health care law as justices. However, Kavanaugh took place in the first round of suits over the Affordable Care Act when he was a federal appeals court judge. Now, Republicans, just a bit of background information, Republican attorneys in 18 states are arguing that the whole law should be struck down because of a change made by the Republican-controlled Congress in 2017 that reduced the penalty for not having health insurance to 0. Today, President-elect Joe Biden is also expected to speak on the high stakes for the American people if the law would be struck down. So stay tuned into News Now from Fox. This is a story that we are following closely, as well as updates from the coronavirus. For now, let's listen into protests that are happening on the Supreme Court steps.
The ACA was one of the key policies that improved the numbers of children with health insurance. Every time the ACA is weakened or threatened, a child is hurt. We should be working to expand coverage for kids, not threatening it with legal challenges. And it's not just the direct coverage for children that is so important. Having good maternity care, something I will mention that is severely lacking in Southeast DC right now, can avoid long, painful NICU courses. Young adults are still able to be covered by their parents' health insurance, allowing them to grow into maturity unburdened by crushing medical debt. And children
harmed them. And I do think it's in tension with this court's Article 3 precedent in several respects. First, what the court has indicated in cases like Daimler-Chrysler is that a plaintiff needs to establish standing for each claim, and they need to show that they are injured by the allegedly unlawful conduct or provision. And here we'd be allowing, on the government's theory, plaintiffs to proceed without doing that. And second, I think it would create a real concern about advisory opinions, because as I understand their theory, you'd have to accept that the provision is inseverable at the standing stage, then you'd proceed to adjudicate the legality of the provision, and then after that you'd get to severability. But as we know from AAPC, most provisions are severable, so it would lead to a situation where courts are adjudicating the legality of provisions that don't actually harm the plaintiffs before them.
Thank you. Justice Alito?
Texas has offered evidence that the Affordable Care Act requires it to calculate Medicaid eligibility using modified adjusted gross income, and that this method of calculation has greatly increased the number of persons on Medicaid in Texas, I think by about 100,000 persons. Why can't Texas seek a declaratory judgment that it is not required to calculate eligibility using that method?
Well, I think that the problem is that they need to show that they're injured by the provision that they actually allege is unconstitutional. And that provision that Your Honor referenced is separate from 5000A. It would remain on the books even if 5000A were wiped away. So unless the court were willing to accept the novel theory of standing by inseverability advanced by the federal government, I don't see how Texas's theories about many other provisions of the ACA can establish a case or controversy with respect to this claim challenging amended 5000A.
Well, there is logic to that theory of standing. Why is it conceptually unsound?
Well, we think it's unsound because it then would allow the court, allow a party to come into court and challenge, any aspect of a large statutory scheme by just asserting a theory that it's inseverable from one provision that harms them. But Your Honor, if the court wanted to create that type of rule in its standing jurisprudence, that would just bring us to the merits. And the problem with the merits theory is that the plaintiffs here are positing that Congress created the very command that this court held in NFIB was constitutionally impermissible. And that's just not a plausible construction when you consider that Congress was well aware of this court's statutory construction. It relied on that choice-creating construction and used it to just render the provision inoperative.
Let me ask this related question. If Texas were to fail to use that method, what consequences would follow?
If Texas were to fail to use the method for calculating Medicaid eligibility, Your Honor?
Yes.
I don't know. I suppose it's possible that the federal government could bring some sort of enforcement proceeding against them, or that an individual could sue on the theory that they should be eligible for Medicaid.
Well, I would ask a related question about what would happen if the IRS attempted to assess penalties on state employers for failing to comply with the reporting requirements in sections 6055 and 6056? In a collection proceeding, could the state argue that it has no obligation to follow that because they can't be severed from the individual mandate?
Well, those are separate provisions. I suppose it's possible that a defendant could try and advance that as a defense in response to such a claim, but that doesn't mean that as a plaintiff they can go into court and establish an Article 3 injury tied to 5000A that's sufficient to exercise the court's jurisdiction.
Thank you.
Justice Sotomayor?
Counsel, if I understand, and please tell me if I understand your point correctly, which is if they have claims challenging the provisions that Justice Alito asked about, they should have brought that challenge, not a challenge based on the individual mandate, correct?
That's exactly right, Your Honor, and although they have discussed a lot of the costs that flow from other provisions of the ACA, they haven't directly challenged those provisions, and they haven't advanced any theory as to why those provisions are unconstitutional.
Second, counsel, give me your best argument why it would be unreasonable or not legally enforceable for plaintiffs to read the individual mandate as a legal command. You answered Justice Roberts' questions in a hypothetical, but I'm asking, are you accepting that hypothetical or that assumption, not hypothetical, I used the wrong word, assumption, or do you have, what's your best argument that it's not a command?
No, we're not, Your Honor. This court authoritatively construed 5000A and NFIB as not a command. It said it was a choice between buying minimum coverage as set out in Sub A or making the alternative tax payment in Sub B. That's an authoritative construction that Congress relied on when it amended the provision in 5000A. Congress did not clearly indicate that it wanted to depart from that choice construction. Rather, it relied on the choice construction, zeroed out the tax as a means of making the provision inoperative. And I think this is a critical point, Your Honor. Congress was entitled to rely on this court's authoritative construction, and we ought to give Congress the benefit of the doubt that it was doing what it said it was doing, preserving a lawful choice rather than imposing the same
But counsel, I have no quarrel with, but why should we presume that a common citizen who wants to comply with the law would make that assumption?
Well,
or should make that assumption legally?
Well, Your Honor, I think that to the extent that a common citizen is considering the intricacies of federal law, they would consider this court's authoritative and very prominent holding about this provision in NFIB. And of course, they would also consider the very public and repeated pronouncements of the President and members of Congress who said we've gotten rid of the individual mandate and now you're allowed to freely choose what to do with whether to buy insurance.
One last question. If I understand your standing argument within this involving the states, but are you arguing that the states are not harmed by the cost of more people enrolling in insurance as a legal matter, or is it that as a factual matter you think they have not yet demonstrated that they were harmed?
As a factual matter, Your Honor, we're on summary judgment. It was their burden to introduce specific facts showing that amended 5000A actually drives up their costs. They put in 21 declarations, but they didn't actually address that point.
So how do you deal with their argument that you had the burden of coming forth with evidence?
Well, I just don't think that that's consistent with precedent. It's the plaintiff's burden at summary judgment to establish that they have satisfied the requirements of standing.
Justice Kagan?
General, just continuing on this point of the state standing, I mean, why wouldn't it be right to say something like, look, you can expect that as a result of this law, more people will buy insurance. Even when there's no enforcement mechanism. Just the force of law itself will encourage people to buy insurance. And Texas is now saying, well, that costs us money. It costs us money because of its effect on programs like Medicaid, and it costs us money because we have to send out these forms saying that you've bought insurance. I think that those are Texas's two arguments.
Well, Your Honor, we think under this court's precedents in cases like Lujan, that might be enough at the pleading stage, but that it wouldn't be sufficient at the summary judgment stage. But frankly, Your Honor, if we're misreading those cases, we'd be happy to lose on the issue of state standing and litigate this case on the merits, and then have Texas's rather minimal showing here set the bar for state plaintiff standing theories going forward. We just don't think that your cases allow it.
And why is that? What case doesn't allow it?
Well, I think it's just the general principle that a plaintiff must adduce specific facts to establish injury and causation, as the court indicated in Lujan, and that we would think would require something more than speculation or supposition.
And how about on the individual plaintiff side? This is going back to the Chief Justice's questions. I mean, why shouldn't the force of law itself, a person can say, if the law says I need to do something, then I have to do something. And that, we want citizens to be law-abiding. Why isn't that enough to create standing?
Well, I understand that point, Your Honor, but I think that that's contrary to what this court has said in cases like Poe. I mean, there the doctor plaintiff said, I'm looking at this law. It says that I can't give advice to my patient, and I think the law is unconstitutional, and it harms me because I'm not able to give this advice. And the court said, well, that's not enough. You also have to show a real threat of enforcement. So I think that would be a departure from what this court has indicated before, and it might open the door to quite a number of additional pre-enforcement challenges.
Thank you, General.
Justice Gorsuch?
Good morning, counsel. Let me pick up where Justice Kagan left off. As I understand it, the United States could still bring a civil action to enforce the mandate under 26 U.S.C. 7402A. Is that your understanding as well?
That's not my understanding, Your Honor. I think that this court made clear in NFIB that the only legal consequence of not purchasing insurance is the requirement to pay a tax, and Congress has repealed or zeroed out, rather, the tax. So there are no remaining legal consequences, and I don't. Let's
just suppose for the moment that you're mistaken, and 7402A would allow a civil enforcement action. Would that change your view about the individual's standing?
Potentially, although I think what this court has looked to is not just the possibility of an enforcement action, but whether there is a real threat of enforcement. And here I don't see how they'd establish that because, of course, the federal government has indicated that there's no further requirement for individuals to purchase health insurance, at least at the highest levels of the executive branch. That's the signal that's sent out to the country.
So individual Americans would have to await an enforcement action before bringing a lawsuit challenging a federal statutory command?
Well, that's our understanding of your cases, Your Honor. But again, if we're misreading the standing cases, we're very happy to litigate this question on the merits because we don't think that they have any plausible basis for reading this as a command, and we'd be happy to have the court reach that question either at standing or on the merits.
And then with respect to the states, again, picking up on Justice Kagan's point, I thought I heard you agree that the theory of standing, that there's raised costs on enrollment-based injuries or compliance-based injuries could be enough to secure standing. It's just a failure of proof at the summary judgment stage. Is that a fair summary of your position?
Yes, that follows from Department of Commerce. States can establish standing if the predictable, if they actually identify specific facts showing that predictable choices by third parties are going to drive up state costs. But unlike the census case where we had lots of expert declarations and specific facts and detailed government memoranda showing that connection, Texas here has just not introduced any specific facts indicating that amended 5000A would inflict a concrete harm on the plaintiff state.
So if all we need is a substantial risk of a predictable effect of government action on the decisions of individuals, why isn't the Congressional Budget Office report stating that even after the penalty is removed, a small number of people will enroll because of a willingness to comply with the law? And it follows from that there will be increased costs to the states.
Your Honor, I think the CBO report from 2017 is probably the best thing they have going for them on state standing. We don't think it's sufficiently specific. It's a single sentence, and CBO didn't offer any data backing it up. And
do you disagree with it?
I don't think that we have any basis to agree or disagree with it.
So it's an uncontested fact in the record?
No, I don't believe that's right, Your Honor. It doesn't say anything specific to the plaintiff states, and it doesn't say anything specific to plaintiffs who are eligible for state health plans. So we wouldn't think that that's enough at the summary judgment phase. But again,
Justice Kavanaugh?
Thank you, Mr. Chief Justice, and good morning, General Mongan. To pick up on individual standing questions of the Chief Justice and Justices Kagan and Gorsuch, suppose Congress passed a law requiring every American who lives in a house to fly an American flag in front of the house. There's no penalty, and the question then is individual standing. Under Lujan, you're the object of the regulation as a homeowner. It's a forced acquisition of an unwanted good or service. Why isn't that enough to give you standing, knowing that some people are going to do that, buy the flags and fly them simply because Congress requires that?
Well, Your Honor, I think if their theory was identical to what the individual plaintiffs advance here, simply that, look, we are actively complying with this and it is causing us harm, that would run into a similar problem with the Poe line of precedent. But there may be some other legally cognizable injury, especially in the First Amendment context. And we're not disputing that plaintiffs can try and advance those types of theories of injury. We just don't think that they're substantiated under the circumstances of this case.
And on the CBO report that Justice Gorsuch mentioned, do you disagree that some people will follow the mandate and purchase insurance solely because of their willingness to comply with the law?
I don't have a basis for disagreeing with it or agreeing with it, Your Honor. I think it is unlikely, as the dissenting judge below noted, that individuals who wouldn't already take advantage of the very generous Medicaid programs or state employer health plans would do it solely because of an unenforceable command. But again, if we're wrong on that, it just brings us to their untenable merits theory that Congress has created a command that this court said was constitutionally impermissible, even as it was telling the American people that it was trying to get rid of or make inoperative this provision.
On the point that you mentioned that allowing individual standing here might open the door, are you aware of any other examples in the U.S. Code, at least, where Congress has enacted a true mandate, not something hortatory, but a true mandate with no penalties?
Your Honor, I'm not aware of that, and we don't think that's what Congress did here. We think that they just...
Yeah, I take that point. I was just wondering if you were aware of an example. On the merits of the claim, under NFIB, obviously it was justified under the taxing clause, but it now doesn't raise revenue. How do you respond to that point?
So in light of the NFIB construction, what Congress did here was to create an inoperative provision. It doesn't require anybody to do anything, and Congress has routinely created inoperative provisions. It's done so since the founding, and they haven't been viewed as constitutionally problematic because they don't alter legal rights or responsibilities or bind anyone.
Thank you.
Justice Barrett?
Well, what should we make of the fact that Congress didn't repeal the provision? I mean, you said earlier repeal, and then you corrected yourself and said zeroed out. I mean, you're asking us to treat it as if it functionally has been repealed, but that's not what Congress did. Does that matter?
Your Honor, I think Congress understood how this court had construed 5000A as a choice, and it understood that it would make the provision effectively inoperative to zero out the tax. And that was a reasonable thing for it to do. Obviously, it was operating under reconciliation procedures. That allowed it to make the change compliant with the Byrd Rule, and CBO had told it that there was no material difference between repealing the provision and zeroing out the tax.
Let me ask you another question that's related to some of the hypotheticals you've heard so far. You know, the Chief asked you about a mandate to mow the lawn, and Justice Thomas asked you one about forcing people to wear a mask. What if, in this case, and as I understand it to be the case, you have to certify whether you've complied or not, and then the government keeps track of that. So the government keeps track of whether you wore a mask or whether you purchased health insurance. Does that change your view of whether there's an injury?
Well, I'm not sure that there is an ongoing certification requirement, at least in the tax forms, Your Honor. Perhaps that would change the analysis. But if we get to the merits, then I think that it's plain that this is not an operative provision, and there is no ongoing command. So even if that would establish standing, it wouldn't be enough to allow the individuals to prevail on the merits. And, Your Honor, I would like to just make the point that if the court were to disagree with us on the merits and hold that this is a naked command, then the only proper remedy for that would be an order making the provision unenforceable and holding that it's invalid. That would completely address the problem. What would be deeply problematic for the petitioner states and for the rest of the nation is if plaintiffs were allowed to leverage this single inoperative provision to tear down hundreds of other provisions that Congress...
Counsel, but let me just return to the question on the merits. So the states have said these forms 1095 B and C do require, as part of taxes, for one to certify whether or not one has maintained the minimum coverage necessary. Is that incorrect?
Well, Your Honor, the states do have to send out the forms. Those are required by separate provisions, and they serve continuing purposes related to the premium tax credit and the employer mandate that have nothing to do with 5000A. So those are costs that they would continue to have regardless of whether 5000A were on the books or not.
And individuals don't have to certify whether or not they've maintained coverage?
Well, the IRS website makes clear now that there's no longer an obligation on the annual tax forms to check the box regarding coverage. They've gotten rid of that requirement.
Okay, thank you, counsel.
Minute to wrap up, General.
Thank you. The plain intent of the 2017 amendment was to make 5000A inoperative and unenforceable, not to impose the very command this court said would be unconstitutional. And the current statutory framework makes clear that Congress wanted every other ACA provision to remain in effect if 5000A were unenforceable, because that's the precise situation Congress created. Respondents' inseparability theory would do violence to Congress's intent, invalidating hundreds of provisions that Congress chose to leave in place and that are functioning perfectly well without an enforceable 5000A. It would cause enormous regulatory disruption, upend the markets, cast 20 million Americans off health insurance during a pandemic, and cost the states tens of billions of dollars during a fiscal crisis. There's no basis for that result in text, intent, or precedent.
Thank you, General. Mr. Verrilli?
Thank you, Mr. Chief Justice, and may it please the Court. Respondents are asking this Court to do what Congress refused to do when it voted down repeal of the ACA in 2017. But their argument is untenable. The 2017 Congress did not convert Section 5000A from a choice to a command. The amended statute doesn't require anything of anyone. And even if one misconstrues 5000A as a mandate, it's not plausible that the same Congress that had just eliminated any economic pressure to purchase insurance nevertheless thought that an unenforceable mandate was so vital that its invalidation should doom the remainder of the ACA. There is just no way that Congress would have preferred an outcome that throws 23 million people off their insurance, ends protections for people with pre-existing conditions, and creates chaos in the healthcare sector. Respondents' arguments take constitutional adjudication as a game of gotcha to a whole new level. But this is not a game. This Court's precedents require respect for the constitutional role of Congress, and those precedents emphatically foreclose the outcome respondents seek.
Mr. Verrilli, 8 years ago, those defending the mandate emphasized that it was the key to the whole act. Everything turned on getting the money from people forced to buy insurance to cover all the other shortfalls in the expansion of health care. And the briefs here on the other side go over all that. But now the representation is that, oh no, everything's fine without it. Why the bait and switch? And was Congress wrong when it said that the mandate was the key to the whole thing? That we spent spent all that time talking about broccoli for nothing?
So, Mr. Chief Justice, in 2010, I don't think there's any doubt that Congress made a predictive judgment about what would be needed to create an effective market, and they adopted a carrot and stick approach. There were a lot of carrots. You know, the policies were attractive, limited copays, no annual or lifetime caps. There were generous subsidies to draw people into the market, and it was easy to enroll because of the exchanges. But there was also a stick, the tax payment if you didn't enroll, and I don't think there's any doubt that the 2010 Congress thought that stick was important. But it's turned out that the carrots work without the stick. That's the judgment that the Congress made in 2017. It's what what the CBO rather told Congress. That Congress asked the CBO, what will happen if we repeal the mandate outright? What will happen if we zero out the tax? And CBO came back and said, whether you zero out the tax or you repeal the mandate, the effects on the market will be the same. The market will remain stable over the coming decade. And if one looks at the amicus briefs filed by the health insurance industry, the Blue Cross brief, the AHIP brief, if one looks at the AMA brief, all those briefs are confirming that that judgment was correct, that it turned out that the carrots worked without the stick, brought enough people into the market to allow it to sustain itself. And, you know, Congress is allowed to learn from empirical experience in the world and adjust its policy choices, and that is what happened here.
General Mongan was asked about whether the burden on the state was enough to support standing. And, of course, he had a little bit of a conflict representing a state, but you don't. Do you think that that burden is sufficient? The paperwork burden, essentially.
No, Your Honor, I don't, because the paperwork burden flows from provisions other than Section 5000A, and so unless the court were to accept the standing through inseparability theory, I don't think there's a basis for finding standing on the basis of that injury.
Thank you, General. Justice Thomas?
Thank you, Mr. Chief Justice. Counsel, Justice Barrett asked whether or not eliminating the penalty of the act wasn't changed, about the mandate provisions weren't changed, just the penalty was eliminated. So was that all that was necessary to eliminate the centrality of this and importance of this provision? Because when you argued that when this case came up, as the Chief Justice said some years ago, this provision was the heart and soul of the Affordable Care Act. And I know the assessment has changed, but the provision hasn't changed with the exception of the penalty. Could you explain why that penalty provision was so critical to the centrality of this provision?
Well, I think, Your Honor, this does go to the heart of the severability question, and I guess the argument that my friends on the other side are making is that the continued existence of 5000A sub A, even though it's unenforceable and there's no tax anymore, is still central to the operation of the Act, such that under the Court's inseparability precedents, Congress would have preferred that the entire Act come down if that provision was struck down. And I think there are 4 reasons why that can't be right. First, you'd have to accept that the 2017 Congress said, we're going to eliminate any financial pressure to stay in the market, but the moral suasion is still so important that the entire law has to fall. And I just don't think that's a plausible account of what happened in 2017. Second, Congress asked the CBO what would happen if they repealed, what would happen if they zeroed out the tax. And the CBO came back and told Congress the effect on the market will be the same either way. In other words, there will be no material difference between zeroing out the tax and flatly repealing Section 5000A sub A. And that's the context in which Congress acted here. Third, the contemporaneous history is quite clear. The President, the congressional leadership, the bill sponsors, the committee chairmen, they all were shouting from the rooftops that they were repealing the mandate and giving citizens complete flexibility about whether to purchase insurance. That is not what you would be saying to the world if you thought that moral suasion was essential to keep the system going. And finally, even if you thought that Congress really did have an interest in continuing moral suasion, that doesn't mean that they would have preferred to bring the whole ACA crashing down if 5000A were declared unconstitutional. And in that respect, I think it's a lot like Celia law. There, in contrast to here, you had actual evidence that Congress wanted the CFPB director to be independent of the President. And that was here was just a hypothesis. There was evidence, but the court made the judgment there that Congress would not have preferred to see the entire CFPB come crashing down if that independence were eliminated. And I think that same kind of reasoning applies very strongly here.
Thank you.
Yes. Justice Breyer, can you hear me?
Justice Breyer?
Yeah.
Thank you, Justice Breyer.
Yeah, I'm connected, I think. Question about severability. Since at the time we heard, when this was first passed, that the mandate was absolutely crucial, as you pointed out, because unless people buy insurance under this mandate, the other provisions such as you don't have to worry about pre-existing conditions, etc., won't work. All right, why isn't that fact?
I'm sorry, Justice Alito?
Something happened. I'm sorry, my machine didn't work.
Yeah, I thought Justice Breyer was still on his time.
No, Justice Alito?
Oh, all right. Well, thank you. Mr. Verrilli, this does seem like deja vu all over again. But let me ask you this question about the theory of standing by severability. Suppose there's a very simple statute. It has two provisions, A and B. I am hurt by B. I am not hurt by A. A is unconstitutional. The statute has a clause that says if A falls, B falls too. Under those circumstances, would I lack standing to challenge A?
Well, that hypothetical definitely tests the limits of our objection to standing through inseverability, and I think it would be hard to maintain that position in the face of a statute like that. But what I will say, Your Honor, is this, that what it does point up, I think, is that if the court is going to validate the theory of standing through inseverability for the first time, that it ought not to do so combined with a presumption of inseverability at the standing stage, because even the situations like the one Your Honor's hypothetical describes are going to be very rare. And most of the time, as the plurality opinion in AAPC acknowledged, severability will be the outcome. And so if one presumes inseverability, even in cases like this one without an inseverability clause, then I think that is, as General Mongan identified, an open invitation to advisory opinions, because you're going to grant standing on the basis of the injury caused by Provision B, hold Provision A unconstitutional, and then say, but it's severable, and therefore the challenger doesn't get any relief. And so I think that's the problem. So I do think if the court really thinks that standing through inseverability is a valid theory of establishing Article III injury, that ought to come with an analysis at the standing stage of the severability issue.
I mean, what you have said about what Congress thought in 2017 perhaps illustrates the difficulty of trying to identify anything that was thought by the majority of Congress other than what it says in a law. A lot of people, a lot of members in 2017 may well have thought that eliminating the penalty or the tax would not cause any harm and the whole act could continue to function well without it. But others who voted for it may have done so precisely because they wanted the whole thing to fall. So I don't know what we can make of what was done in 2017 along the lines that you've said.
So, Your Honor, I think that question points up the wisdom of the analysis in the AAPC plurality to focus on objective indications, statutory text and context. And beyond that, I would say I don't think it would be an appropriate thing for the court to do to assume that there were members of Congress who actually acting in violation of their oath to uphold the Constitution by voting for a provision they knew to be unconstitutional in the hope it would bring the law down. I just don't think that's a premise the court ought to indulge in any case, and certainly not in this one. When applying the objective factors, what we know is that Congress zeroed out the tax penalty, which is a very strong textual signal that Congress did not think that the 5000A sub A was necessary to play any significant role in maintaining these markets. And of course, the context here.
Justice Breyer, we apologize for the audio difficulties, and we'll go back to you.
Oh, that's all right. It's not a problem. Go ahead.
Justice Sotomayor.
Counsel, am I assuming your answer to be that given a choice between, or among, because there could have been many choices, between invalidating and the entire ACA and just zeroing out the tax, that the 2017 Congress's choice was to just zero out the tax, correct?
Yes, that's manifest on the record, Your Honor. There were efforts to repeal the entire ACA. Those efforts failed in the Senate. They were voted down. So we know that that effort to repeal the entire ACA was voted down, and the only change made was the zeroing out the tax in 5000A.
And so if the choice is, yet again, after NFIB, declaring the individual mandate unconstitutional, if one sees it as a command, the 2017 Congress has already told us that it doesn't want the rest of the act to fall, correct?
That's certainly our position, Your Honor, and that and it just would be utterly inconsistent with everything Congress had before it, with the judgment Congress made, and with the wide announcement to the public that this amendment effectively repealed the mandate.
Counsel, there's an intuitive feeling that if the individual mandate is struck down with respect to standing in the states, that they would have less reporting cost because, or less enrollees in their Medicaid and CHIPS program. That's their argument about standing, correct?
That's their argument. That aside from inseparability, that's the only direct injury they claim flows from 5000.
Would you address that argument? Your co-counsel for the states seems to say there's no evidence that that's true or false. But I thought many of the briefs showed that it was a faulty premise for other reasons. Do you agree with that?
Yeah, I mean, there's definitely no evidence. General Mongan went through that. That's correct. It was summary judgment, and under Lujan, they had a burden. They didn't meet it. But apart from that, basically their argument, I think, boils down to what they claim is common sense, which is that, look, people are going to read this mandate and they're going to enroll, and that in Medicaid to satisfy it. But, I really think it's the opposite of common sense. I mean, the theory here is there were people out there who weren't enrolled in Medicaid before when the mandate was accompanied by a tax consequence, and therefore were subjecting themselves to the tax consequence. Congress amends it to get rid of the tax consequence, and those people say, oh, well, Congress got rid of the tax consequence, but look, there still seems to be a mandate, so I'm going to go enroll in Medicaid now.
Justice Kagan?
Mr. Borelli, I understand your view that the empirics of how this law works have changed since 2010 or 2012, but we still have some relics of the old view, which is that the individual mandate was the key to everything, some relics of that in the law. And I'm pointing specifically at what the plaintiffs in this case sometimes call the Inseparability Provision, which is a finding, basically, that the mandate was essential to creating effective health insurance markets. And I guess I'm wondering, what do we do about that, the fact that that finding still exists in the law? Does that constrain us in any way?
Well, it's clear that I think that it doesn't overcome the strong presumption of severability because it's not an inseverability clause. Now, if the Section 18091 had said, if Section 5000A is declared unconstitutional, then 42 U.S.C. 300 GG shall be deemed inseverable. Those are the insurance protection provisions. We'd have to make an implied repeal argument. I think we'd have a strong one, but we don't need to make that because the finding is not an operative provision of law. It's just a finding, and I think what's key is that what it expresses is the 2010 Congress's view about the state of affairs that existed in 2010. As a textual matter, the provision is addressing Section 5000A as it was originally enacted in 2010. That is, the insurance, the mandate to purchase insurance backed by the tax. Now, the argument that my friends on the other side are making is that the 2017 Congress must have continued to agree with that finding because it didn't repeal the finding. But the 2017 Congress couldn't possibly have agreed that a requirement backed by a tax consequence was essential to an effective market because the 2017 Congress eliminated the tax consequence. And so I think that's very direct textual proof that the 2017 Congress did not share the view of the 2010 Congress expressed in the finding. And then it comes down to the question of, well, whether you're going to strike this entire law down because the Congress didn't go back and clean up that finding. But there was no need to clean up that finding because, as I said, it's not an operative provision of law, and it expresses a predictive judgment about the circumstances that existed in 2010 and what the 2010 Congress thought would be necessary to create the market. And textually, of course, the finding talks about the requirement being essential to creating the market. And by 2017, the market had been created. It was up and running. CBO told Congress to continue to run in a perfectly reasonable way if you eliminated this penalty. So I think that remnant from the finding.
Good morning, Mr. Verrilli. I'd like, if we could, just for a moment, put aside standing and put aside your remedial arguments and just focus on the merits. This court held that the mandate was a permissible exercise of the taxing authority because it produced revenue, at least some. That seems to have withered away, and we're left with the Commerce Clause and the Necessary and Proper Clause, which the court foreclosed last time around. Can you help me with that?
Sure. I think it might help for me to walk through how we see this, Your Honor. The Congress started with the court's definitive construction of the law in NFIB. That the court presumes that Congress takes this court's definitive construction as a given, unless it clearly indicates a desire to change it, and we don't think it did that. And so it starts from the premise that this is a lawful choice. It was a lawful choice between maintaining insurance or paying the tax prescribed in subsection C. And I don't think there's any doubt that Congress was acting within its powers when it amended subsection C to reduce the tax to zero. You can either think of that as inherent in the tax power or necessary and proper to it, but it has to have the ability to take that step. And so what remains is a statute that isn't operative and doesn't have any consequences for anyone. So it's effectively like a statute that's been repealed, and that's, I think, why so many in Congress and the President described it as effectively as a repeal. Now,
well, let's just put that aside for the moment, okay? And if we're focusing on the merits and assume the mandate is still something, it's on the books. What are the merits of that under the Commerce Clause? Why aren't you clearly foreclosed by NFIB?
Well, we're not making an argument under the Commerce Clause because of NFIB, of course. You know, our view is that because it's an inoperative provision at this point, that it really doesn't have any more need for an enumerated power than when Congress enacts a hortatory statute. I understand the premise of Your Honor's question is to disagree with that. I think to the extent the court thinks an enumerated power is necessary, we think it could be justified as necessary and proper to the taxing power because it leaves the framework of the taxing mechanism in place in case Congress wants to do it in the future.
Thank you, Counsel.
Justice Kavanaugh?
Good morning, Mr. Verrilli. Assume standing for purposes of these questions, and on the merits, the mandate as currently structured seems difficult to justify under the taxing clause for the simple reason that it does not raise revenue, among others, so it's hard to call it a tax now. And so I think you were just indicating you can't justify under the Commerce Clause because 5 justices in NFIB said you couldn't. Can you explain your necessary and proper argument, just so I have that? You were on that.
Yeah, it's the one we made in our brief, Your Honor. It's that the Congress says the way the law exists now, the Congress has maintained the structure that existed before the zeroing out of the tax in 2017, such that should Congress decide in the future that it needs to reimpose a tax, that it doesn't need to engage in wholesale reworking of the law, it can just step back in and change the number again. And in that respect, it's not entirely different. It's not the same. I'm not saying it's the same, but it's not entirely different from a tax law that Congress enacts where the tax is suspended for a number of years, and we think that suffices. But I do think, Your Honor, that what this points up, even if the court disagrees with us here, and even if the court thinks that...
I'm sorry to interrupt, Mr. Verrilli, but let's assume, just for the sake of argument, assume I don't agree with that, and then we get to severability. I tend to agree with you. This is a very straightforward case for severability under our precedents, meaning that we would excise the mandate and leave the rest of the act in place, reading our severability precedents. One of my questions is, do you think that's would have been the right result under the 2010 Act, or did that change in 2017, or how would you assess that?
Well, I thought the amicus in 2010 made very strong arguments in favor of that result, but I do think the relevant point of inquiry was what did the 2017 Congress think, and I do think with respect, what would the 2017 Congress have preferred in the language of Celia law and the AAPC opinion? And I think that the answer, the objective answer to that is quite clear, that that the very same Congress that zeroed out the tax and therefore removed any economic incentive, any economic suasion to get insurance, couldn't possibly have thought that the provision was continued to be essential to the operation of the overall system.
Thank you.
Justice Barrett?
Mr. Verrilli, if the court construes a statute in a particular way in order to avoid a constitutional question, wouldn't Congress be free to come back and say, no, 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 that is what we meant, and in this case, for example, we did want to rely on the commerce power? In other words, why would an avoidance construction of a statute lock Congress in?
Neither an avoidance construction nor a straightforward construction would lock Congress in, Your Honor. I agree with that. But here I think that, but I do think the presumption applies either way. Once this court has definitively construed a statute, that is what the statute means. And the court assumes that Congress takes that meaning as a given and can rely on that construction by the court when it amends the statute, and absent clear evidence that Congress wanted to depart from the court's definitive construction, the presumption is that the definitive construction stays in place. And I do think that has to be the case here, because the only way to make sense of what Congress was doing and what, as I said, everybody involved in this process said Congress was doing, was that they assumed that the choice-creating structure that was the definitive construction of the Act after NFIB remained, and that by zeroing out the tax, they relieved any perceived need by anyone to purchase insurance if they didn't want it. That's what everybody involved in this process said they were doing.
Why couldn't we say that when Congress zeroed out the tax, it was no longer a tax because it generated no revenue, and therefore could no longer be justified on the taxing power, so Congress was presenting it as a mandate which would have to be justified by the Commerce Clause?
Well, I think for the reasons I said, Your Honor, and I do think that the statements by the legislature, by the legislators and the President and everyone else, I know that that's legislative history in a sense, but I do think there's wide agreement that those kinds of statements can be looked to as evidence of what, of the meaning that a provision is capable of bearing. It's clearly capable of bearing the meaning that we've identified, and it seems like the only explanation for what Congress did here is that they assumed that that was its meaning. If they had assumed the opposite and wanted to impose a command, I presume they would have, somebody would have said that, and everybody said the opposite. And of course,
a minute to wrap up, Mr. Verrilli.
Thank you. The Affordable Care Act has been the law of the land for 10 years. The healthcare sector has reshaped itself in reliance on the law. Tens of millions of Americans rely on it for health insurance that they previously couldn't afford. Millions more rely on the Act's other protections and benefits. To assume that Congress put all of that at risk when it amended the law in 2017 is to attribute to Congress a recklessness that is both without foundation in reality and jurisprudentially inappropriate. In view of all that has transpired in the past decade, the litigation before this court, the battles in Congress, the profound changes in our healthcare system, only an extraordinarily compelling reason could justify judicial invalidation of this law at this late date. Respondents' arguments in this case are anything but. They should be rejected. Thank you.
Thank you, counsel. General Hawkins?
Thank you, Mr. Chief Justice, and may it please the Court. This case should be resolved on the basis of 3 operative provisions that appear in the U.S. Code today. The first is the individual mandate, which is a command to the American people to purchase health insurance that the federal government deems suitable. The second is a penalty provision that ensures that the mandate raises no revenue for the federal government. The third is a legislative finding enshrined in the text of the law itself, declaring the mandate essential to the operation of the marketplace reforms that the ACA set out to achieve. The Obama administration's Department of Justice described that finding as a functional inseverability clause. Under NFIB versus Sebelius, the mandate as it exists today is unconstitutional. It is a naked command to purchase health insurance, and as such, it falls outside Congress's enumerated powers. And the legislative findings declaring the mandate essential require this court to conclude, as did the district court below and the joint dissent in NFIB, that the mandate is inseverable from the remainder of the law. In asking the court to hold otherwise, petitioners are really asking this court to ignore statutory provisions in the U.S. Code. Petitioners instead prefer to hypothesize about what various legislators might have been thinking when they voted to eliminate the penalty provision, yet retain the mandate and the legislative findings. But that's just an argument that this court should set aside the text of the law in favor of non-textual considerations. That gets things exactly backwards, as this court has confirmed time and again in recent years. There is no basis to ignore the words that Congress enacted and that remain operative today. The proper course is to take Congress at its word and declare the mandate unconstitutional and inseverable from the remainder of the ACA.
General Hawkins, on the severance question, I think it's hard for you to argue that Congress intended the entire act to fall if the mandate were struck down when the same Congress that lowered the penalty to 0 did not even try to repeal the rest of the act. I think, frankly, that they wanted the court to do that, but that's not our job.
Well, Mr. Chief Justice, I would respectfully submit that it is this court's job to follow the text of the law as written, and I think it's critical that in 2017, Congress could have excised the legislative findings in 18091, but it chose not to do so. It could have excised.
But I mean, I certainly agree with you about our job at interpreting the statute, but under the severability question, we ask ourselves whether Congress would want the rest of the law to survive if an unconstitutional provision were severed. And here Congress left the rest of the law intact when it lowered the penalty to 0. That seems to be compelling evidence on the question.
I don't think so, Mr. Chief Justice. I think what that establishes, or at least one reasonable reading of what happened, is that Congress wanted to give the American people a tax cut. And it went through lots of provisions of the Internal Revenue Code, cutting taxes here and there. And one place it found to give the people a tax cut was in 5000 AC. But it wanted to keep that mandate in place because the mandate would still drive people to acquire insurance. And indeed, it would have been quite reasonable for Congress to conclude that simply having a mandate will lead people to sign up for health insurance. As originally enacted, the Affordable Care Act included groups of people who were subject to the mandate but exempt from the penalty, including the very poor and members of Indian tribes. And I think that's an indication that Congress believed that simply ordering people to do something would get them to do it, notwithstanding any penalty that may be attached.
General, you talked about the findings in the legislation and treat them as if they were an inseverability clause, but it doesn't look like any severability clause anywhere else in the rest of the U.S. Code to me.
Well, Your Honor, there's certainly no magic words requirement for a severability clause or an inseverability clause. What we see in 18091 is a repeated emphasis by Congress that the mandate is essential to what they were seeking to accomplish. This is not some fleeting reference in one provision. In subsections H, I, and J, we see over and over again
Thank you, counsel. Justice Thomas?
Thank you, Mr. Chief Justice. General Hawkins, I think we're shadow boxing a bit here. The individual mandate now has no enforcement mechanism. So it's really hard to determine exactly what the threat is.
All right, everybody, here on News Now from Fox, we were listening to the oral arguments there on the Obamacare case at the Supreme Court, a decision likely to come sometime in late June. Hi, everyone, and welcome to News Now from Fox as we continue coverage live right here, bringing you all the live events that are happening across the country. Let's go with another one that just popped up. We're going to take you out to Washington, D.C. Keep you out there where we do have the Senate Judiciary hearing just starting right now. This is day 4 of the Crossfire Hurricane investigation. The witness will be Andrew McCabe, the former acting FBI director, talking about allegations of misconduct within the FBI on possibly spying into the President Trump campaign and Russia investigations. Let's listen right here on News Now from Fox.
Inspector General's report found 17 policy violations regarding the way the Crossfire Hurricane operation was performed. The FISA court basically rebuked the FBI and the Department of Justice regarding the